Ladies and gentlemen, a warm welcome to the conference. I'm Pooja Bothra, and it is my privilege to take you through this session as we unveil a white paper that is set to redefine the landscape of workplace well-being. Today, we delve into the realm of respiratory infections and the transformative power of workplace vaccinations. Now, you might be wondering why the emphasis on respiratory health. The answer lies in the stark reality that infectious diseases, especially respiratory infections, pose a significant threat to both individual well-being and organizational success. A recent report by prudent insurance brokers revealed an unexpected trend, with a notable 36% of respiratory claims filed by employees aged 21 to 60. I repeat, 21 to 60. Contrary to the common perception that respiratory illnesses primarily afflict young children and older adults with weakened immune systems. This white paper is not just a document. It's a roadmap where key stakeholders such as medical practitioners, human capital policymakers, chief medical officers from corporate world, insurance brokers, and wellness experts have shared data insights, best practices, and policies converging corporate wellness and vaccine-led proactive healthcare. Vaxfit Unleash the Power of Workplace Vaccination, that's what we call this white paper, explores the post-COVID paradigm and dives deep into the heart of the matter, respiratory and pneumococcal infections in the working population. It underscores the crucial role of adult immunization in fortifying overall health care. As we navigate these challenges, the white paper provides facts and figures and a practical guide and a step-by-step implementation strategy for integrating workplace vaccination seamlessly. But the journey doesn't end here. The Center for Disease Control and Prevention emphasizes the need to invest in employee health through workplace health programs. Vaxfit aligns with the vision, offering insights that could lead to substantial 25% reduction in absenteeism, healthcare expenses, and workers' compensation claims. As we launch Vaxfit today, yes, after 3 months of hard work today at this conference, amongst all of you, we are planning to launch this white paper. We are super excited. We are championing a cause that recognizes the power of preventive measures, the potential of workplace vaccinations, and the undeniable link between a healthy workforce and a thriving organization. To officially unveil the white paper, I'm super excited to invite Dr. Pankaj Gupta, Senior Medical Director, Pfizer, Jayanta Zaveri, Assistant Vice President, Business Development, Prudent Insurance Brokers, and Ritika Mathur, Partner, Human Capital Consulting, Grant Thornton Bharat. Ladies and gentlemen, the QR code is on the screen to download your copy of the white paper right now. This is the white paper. All you need to do is scan the QR code and you're going to get your copy. So as we are talking about workplace vaccination, Dr. Pankaj, I'd like to ask you, how do you see workplace vaccination plugging the public health gap, especially in the context of respiratory infections?
Good morning, everyone, and thanks for having me. Before I actually look to answer that question, I have an interesting question for the audience here. If everyone's ready for a quick audience poll, I just want a quick show of hands on how many of you have taken the COVID vaccine? Lovely.
Wow,
lovely.
that's like literally all of them.
You've done good for yourself, you've done good for the country. Now, if I have to ask the same question, how many of you have taken any vaccine in your adult life other than a COVID or a flu? And if you can just look around, the sparse hands that kind of were shown, I think that's the biggest public health problem. The awareness, motivation, and urgency towards vaccinating is just not there, unless we're hit by a pandemic like COVID, which kind of galvanizes the entire population, the healthcare system, the public, and just there's this urgency to kind of receive the vaccine. No, and you asked about the public health problem. I think from a country perspective, we are saddled with three problems. One is a never-ending issue of the infectious diseases, but that we have known for decades and centuries. The second is the lifestyle disorder-related chronic non-communicable diseases which are on the rise. And the third is what we experienced 2-3 years back, which is newer pathogens which are coming and have an endemic or a pandemic kind of a potential. And we all know that the healthcare infrastructure in India is so overstretched, right? The population to bed ratio, the doctor to nurse to population ratio, nurse to population ratio is kind of suboptimal. I think the best strategy for us as a country, as a public health system, should be keeping patients or people out of hospitals. And how do you keep people out of hospitals? I think there are only few cost-effective measures that have, that we have seen. As much as the immunization or vaccination. And I genuinely believe that in the last 1 century, apart from clean drinking water, vaccination has been the only proven cost-effective method to keep people out of hospitals, prevent diseases. So I think that gives a segue to some of the important and alarming statistics that we should all be aware of, right? You also talked about the respiratory infections, and respiratory infections right now are acknowledged as the top reason for people visiting clinics and top reason for people missing on work, absenteeism from work. Worldwide, pneumonia out of all the communicable or infectious diseases is considered as the top 4 killer. Almost 1.6 million people lose their lives because of pneumonia every year, more than the more known kind of diseases like HIV, AIDS, or malaria, or seasonal influenza. But people don't talk about pneumonia or pneumococcal diseases so much, right? Even in India actually contributes to 1 in 4 of those global deaths that I was talking about on a yearly basis. Now that's a alarming and a sobering thought at the same time. Almost 30% of all the communicable disease load in India is pneumonia, and that leads to a lot of deaths. So a lot of statistic for us to kind of just introspect on, have we thought too much about respiratory health and respiratory infections and diseases, and how do we prevent ourselves, our colleagues, our family from that? I think, and I'm so glad that we're kind of having this discussion here to kind of raise the awareness and drive possibly urgency around some of these issues. As at Pfizer, I represent Pfizer, and our endeavor is to continuously, try and save as many lives as possible by coming out with vaccines that, prevent life-threatening illnesses. And I'm so glad that we got the opportunity to partner with ETHR for this initiative, which hopefully possibly supports the HR leaders that I see in this room to go back and have discussions within their organizations around wellness, preventive health, and most importantly about integrating workplace vaccination into their wellness programs.
Yeah, very rightly said, though some of these numbers do sound alarming, and we've covered those facts in the white paper, and we're very thankful for Pfizer to collaborate us for this very, very essential document, a depository of insights on this critical subject, which sometimes goes maybe, it's sidelined amongst the other business decisions that, we need to make. Also in this white paper, prudent insurance brokers have shared very, very important insights around respiratory infections, and we have a leader from there, Jayata. And Jayata, I would like to ask you, what is Prudent's viewpoint around preventive healthcare and its overall influence on corporate well-being?
Thank you so much, Pooja, for having me here today, and it's a wonderful gathering. India in general needs to make a leapfrog in healthcare, just like we did in the telecom industry, a couple of decades back, where we moved to a mobile in each hand versus a landline in each house, right? So likewise in healthcare, we need to change the focus from continuously looking at inpatient hospitalizations to looking at preventive, predictive, and primary health care to take center stage and focus. At Prudent, we strongly run by a lot of data-driven analytics, and we do offer all our wellness programs to our corporates, that we work with, also along with all of these kind of data viewpoints. In a recent claims analysis survey that we did, we realized that there is an 18% surge in the last couple of years just in respiratory, claims that have been hitting the corporate world. You did share one of the crucial points, and of the top two, when you keep saying pneumonia, it strikes me that the top two amongst these are definitely, one is your respiratory tract infections, and the second being pneumonia. Right, I think Pooja, you did mention that, right? That, we've seen a 36% claims come in from employees who are in the age group of 21 to 60.
Correct.
And that is surprisingly, something that came as a surprise to us as well. And, this is something that can be prevented, right? We can look at a lot of preventive measures to make sure that these kind of claims, do not hit the inpatient hospitalization. 25% of the organizations have lost close to, I think, 50 working days just due to absenteeism out of sickness. And I think that is what, motivated us, again, to partner with EconomicTimes and Pfizer and, build this whole vaccination blueprint so that the HR leaders who are present here and elsewhere across the country can actually integrate vaccination into their current benefit plans as well as their current, strategies that they have for, employee well-being overall. So yes, wellness is a very wide word. It's continuously evolving. We've seen a lot of changes from pre-pandemic to post-pandemic in wellness. And however, I think the focus should be, how do we look at the overall health of an individual? How do we engage deeply with our employees and not just be a pair of catastrophic hospitalizations?
So in this white paper, we also thought it was essential to take bites from HR industry leaders, who are people leaders who make policies around well-being and wellness. And to our surprise, there are organizations who are working, in creating a policy around workplace vaccination. And we also have a non-healthcare industry representation here, who is a human capital leader, Ritika. And Ritika, I'd like to ask you that how do you see respiratory infection fit in the well-being spectrum? What are your thoughts on that?
Thank you, thanks Pooja, and thank you everyone. So, we were laughing backstage that beyond being the human capital partner, my expertise on this panel comes from the fact that I'm from Delhi, which is like the smoke capital of India, right? So therefore, respiratory issues form part and parcel of our way of life in a way, right? But jokes apart, we touched upon some statistics, both when you were speaking, when Dr. Pankaj and Dr. Jayata were speaking as well. I'd like to add one more statistic from a business perspective here, right? So a research that was conducted in the US gave this very sobering statistic that just through the loss of productivity just because of common cold in 1 year in the US has been about 25 billion. And Prateek very rightly mentioned when we were talking backstage, that is equivalent to the profitability of Walmart annually. So if you see from a very numbers perspective, like you were talking about, right, it's actually a business imperative now to think about aspects that go beyond wellness to larger well-being. And I think respiratory aspects, form front and center. So if you ask me, where do they fit in the larger spectrum, they fit right in the center, right? And one of the very important things to also realize is that when you talk about respiratory diseases which could be contagious, for example, the decisions, the policies effectively are not only centered around the employee, but the larger ecosystem as well, right? In the statistic that I quoted earlier, that 25 billion constituted of a large part of absenteeism that was there because of people who had to take leaves because they were caregivers, or because there is a cascading impact in closed spaces, for example, in offices that we sit, right? There is, because we stay in close quarters, there is a cascading impact of that infection actually passing down to people who sit around us as well. So few of the things that I have seen, some of, things that we have done, for example, and things that I can see HR leaders really taking the lead on. One, of course, is education, like Dr. Pankaj also mentioned, right? A lot of us don't even understand the impact and the benefit of vaccination, and that's why, as HR leaders, it becomes important for us to really educate our people, and possibly also create initiatives that makes these education, education a lot more accessible to our people. Also make policies which are a lot more flexible, including not just the employee, but the larger ecosystem as well. That's how it becomes easier for people to understand, to relate, and to adopt some of these aspects also. And third also is the workplace infrastructure. I can give you an example of our office. We've got an office in ETHRWorld. It's right the center of all the polluting aspects around it, right? But if you get inside the office, there is a lot of green infrastructure that we have built within the office, simply because of the fact that we realize that while you are in office, you cannot expect for people to sit with their masks on. It's just, while it's a best practice, it's not enforceable if you're sitting in office for 8 hours, 10 hours, right? And that's why we created that infrastructure with the right kind of HVAC, air purifiers.
And Ritika, sorry to interrupt you. It's a very interesting point she's brought about, that we are having air purifiers, we are going green, we are, putting these plants which kind of give oxygen and all. But what are we doing about, preventive vaccination that could protect us so much from these respiratory infections?
No, absolutely. But like you said, like Dr. Pankaj very rightly touched upon, preventive vaccinations, I think the first point that I will tackle there is just the education aspect, because not enough people know about the fact that the respiratory disorders or respiratory aspects could really be prevented through some of the vaccinations that could be taken upon as well. So I think that would be the first thing that I would talk about. And yes, I mean, in today's day and age, they've, in my opinion, formed the front and center of all strategies around well-being and wellness in corporate.
Yeah, and at this point, I just want to take a moment to reflect on the fact that most of the corporate world are in cities like Delhi, Mumbai, Bangalore, where respiratory infections are very high. Delhi, because of pollution; Mumbai, because of the monsoon, the bronchitis is very common; Bangalore, because of pollen. So, that also creates an impetus for preventing respiratory infection to vaccination. So I'll quickly take a closing point from all my speakers before we leave the stage, and remind you once more to download the report. That what would be your closing statement, given the fact that individual productivity, overall business productivity, and reducing the healthcare cost, which is really rising, all depends upon proactive vaccination. Dr. Pankaj will take a closing statement from you.
Sure. I think it's high time that we as a country and as a healthcare system move from a reactive approach, a more treatment-focused approach, towards a more proactive approach and a more prevention-focused approach. And I think vaccination is a vital cog in this transformation in my mind. We are the vaccines capital of the world. We produce 60% of the world's requirement of vaccines, but vaccines don't save life. Vaccination saves life. So we may be producing vaccines, but are we using the vaccines? Less than 1% of the adult population in the country is vaccinated for the age-appropriate vaccines, and that's something that we need to change. And possibly the change agents could be all of you. When you go back to your organizations, drive conversations with the important stakeholders around workplace vaccination. around preventive and wellness programs being integrated with the vaccination at the front and center of it. We at Pfizer are happy to partner with you if you need any support from our end, from a knowledge partnership perspective, or from if you want to just brainstorm on the various ideas on how you could make workplace vaccination a reality in your organization.
Yeah, so he did touch upon a very crucial point where we don't have the best of hospital infrastructure in our country, and WHO for the last 25 years has been constantly reminding us and telling us that we have a very, very poor bed is to citizen ratio in India. We are currently at a 0.5 per every 1,000 citizens, where we clearly need to be at least at a 3 for every 1,000 citizens in this country. And how are we going to bridge this gap? It's a huge gap to fill. And when you look at it from the Indian healthcare standpoint, right, I would say that looking at preventive healthcare, looking at your health checkups, or looking at vaccinations that could decrease the intensity of the so-called vaccine preventable diseases, that is the way to go. This would also, I do understand that at some point in time corporates do come back to us and ask us about how is this going to impact cost, and this will, right, it decreases over a period of time. It will decrease your inpatient hospitalizations, which are the big ticket items, right, and at the end of the day this will eventually lead to a much more productive workforce, a much happier, healthier and engaged workforce, and also a lot of loss of absenteeism and a good quality life for your employees. And I would just like to end by saying a couple of things. I think you did say that we are the vaccine capital of the world. We make the maximum number of vaccines. We are also the chronic disease capital of the world. And I don't see any reason why we can't become the health capital of the world. But at the same time, preventive and primary care should be the mantra for every payer, every provider and every employer in our country.
I think I'll just add from an HR leader's perspective, what is our role in driving some of these and enabling some of these changes. I think the biggest role that I see HR leaders really play is that of creating awareness and also creating accessibility, because a lot of times, let's be honest, we will have people who will possibly not really, and unfortunately that's possibly just the Indian culture, the way we are kind of brought up, but we really don't think of these things till the time it's really on our head to actually go ahead and treat rather than prevent. So therefore, being able to make this a lot more accessible and really bringing in the awareness part in our larger well-being calendars, in our larger well-being campaigns, that would really go a long way in bringing this again in the front and center in people's mind. And I think also will augur the success of some of these initiatives in organizations, because let's also be honest that employees do expect that now from employers, right? Total rewards and benefits really are on the top of their mind, wherein what are we getting, what are we doing beyond compensation to really improve the quality of life, like Dr. Joyita said. And I think this will be a great addition to the well-being campaigns that all of us would be running in our organizations, by helping them know about it and also helping them really make it accessible for them.
Thank you. All of you have made a solid case for workplace vaccination, and I like to also end by saying that in this journey over the 3 months, we also met about 60 plus HR decision makers, CHROs, policy makers, and there is yet lack of clarity as far as these infections are concerned, like pneumococcal, and the role of influenza and these vaccines. So this white paper will help to demystify this subject and give you step-by-step implementation strategies, and there is also FAQ and data. So this is a complete, one stop for you to, a roadmap for future. Thank you so much, all of you.